Okay, I'm Travis Gerald. This is Thomas Redding. Thomas is a teaching pro out at Charlotte Country Club, and he's gracing us with his presence this month as we go through a series on how we can use manual therapy to help golfers have more options for their golf swing. So the more options a golfer has, the more the teaching pro can then craft their swing, because they really have to craft the swing around what options they have in their body. So first thing we're going to talk about in this video is posture. So Thomas, go ahead and get into your 5-iron stance. And just looking at his 5-iron stance, it's really pretty good starting out. Okay, he's got a nice straight spine here and into softness down into his legs. What we're looking at specifically is the spinal curves. Okay, there's something called an S posture where the spinal curves get exaggerated. So go ahead and go into that S posture. So he really arches his back. He then has to just be overextended in this position, okay? So that's not great. And then also the opposite of that would be more of a C posture where he goes ahead and he rounds his back, okay? Now, these are okay starting out if you can cue them out of that position, okay? So for go into the S posture again. So for the S posture, we actually want him to flex his pelvis forward and extend it back, okay? And so he's gonna flex and extend his pelvis there, go all the way back forward, and then come off of that just a little bit. And that puts him in a neutral kind of pelvic position. He's gonna relax his shoulder blades down just a little bit there, and now we have that neutral posture, okay? Now go to a C posture, where you're really rounding through here, okay? So say he's rounded, and like, you feel how you're rounded through here? Can you extend up a little bit? There you go, good. And then from there, maintaining that position, we then can go through that pelvic correction to make sure that it stays in a more neutral position. If he can't correct through this area, if he's really stiff either here or through the front of his chest or somewhere in his ribs, we need to address that. And specifically, I think addressing through the mid-back would be ideal, and that's going to be what we'll go through options for that for manual therapy in the next video.